Good afternoon, and it is the World Women's Day today, and by this I'm going to be discussing about few things which I would want you to sit back and join me in as I continue to discuss it. Now, we know that common causes of death that we are aware of include cancers. In women, we talk about breast cancer, cancer of the cervix, which is the mouth of the womb, cancer of the womb itself, and other cancers like that. And today I'm going to be talking about two measures that can actually be used to prevent two of these cancers. And two of these cancers are top on the list of the causes of cancer death in women. So I want us to join and implement what you are going to be learning from this today. Then, apart from listening to this, I also want you to go ahead to find out more, to learn more about the things I'm going to be discussing today, so that you will be able to implement and use all this in order to benefit you from preventing such cancers. Now, I'm going to be talking about perpendicular smear. I'm also going to be talking about self-breast examination. These two things that I've mentioned, self-breast examination and perpendicular smear, they are measures that can actually be done by you. I mean, you as a woman can actually do this on a regular basis, as it has been prescribed and it has been shown to help in reduction of the occurrence of these cancers that they are meant to peak. Now, for the self-breast examination, it is well known that it can help to prevent the occurrence of breast cancer by early detection. And when there is early detection of such cancer, it can actually be treated on time, when the deaths that could occur from the cancer wouldn't have occurred. And also the perpendicular smear, which is like a routine test, like a screening test meant for cervical cancer. This one also has been shown to reduce the occurrence, the number of cervical cancer. Now, let's start with the self-breast examination. Self-breast examination is an examination that is done by individuals. It is done by individual on their breast in order to be familiar, or to get familiar with the texture or the appearance or things that are happening within the breast. And this is actually recommended that it should be done every month at about a particular time of the month. Take, for example, for women that are still menstruating, it is said that you pick the 5th day after you have finished your period, and by this you do it always at this time every month. It makes you familiar with the breast appearance, so that at the onset of any abnormality or any appearance that is different from what you have known, you can actually go ahead to the physician that will help in further examination to really know if there is any abnormality that is present. So now, self-breast examination involves the woman palpating in a systematic manner the two breasts. Usually a woman is supposed to stand upright in front of a standing mirror to check for the color, the shape, or if there is any discharge from the nipple, in order to pick or have the idea of anything going wrong in any of the breasts. For women that are not menstruating again, it is recommended that they pick a particular date of the month, and at about this time they do this self-breast examination every month in order to detect if there is occurrence of anything different from what they have been used to. Now, a woman stands upright in front of a standing mirror. She offs her wear from the level of the waist upward and stands at akimbo in front of the standing mirror. in order to check underneath the breast, both breasts. You want to check underneath to check for skin discoloration. Is there any mass or swelling that you can see? Is there any nipple discharge or even change in shape? It can also, standing at this position can also afford you the opportunity to see if there is any difference in the level at which the two nipples are. Breast nipples that have been about the same level before, with the occurrence of abnormality, it is possible that there will be retraction or withdrawal of any of this breast tissue or breast nipple, which will point you to the fact that there is need for further examination on the breast. So what I've been saying in essence is that this self-breast examination helps a woman to get familiar with how her breast is, and with the occurrence of anything that is different from how it used to be, a woman would be able to pick on time and would be able to go ahead to present herself to the physician, who will help in further examination to know, and even recommendation of appropriate tests that will help in identifying if there is any abnormality. Now, what I've said is, I think you really need to go ahead. You read about it more. You can read more on Google. You can read more on YouTube videos. There are still going to be more videos that I'm going to be releasing subsequently on this, on how to do self-breast examination. But with this, I want us to really learn about it and begin to implement, so that it can help us pick if there's any abnormality, as it has been shown that it can actually prevent death from breast cancer. Now, for the Papa-Nicolau smear, I've said that is a routine test, like screening, that is meant for cervical cancer. Cervical cancer is a common cause of death in women, especially in developing countries like ours, and is a test that is quite available. How often you need to do it is not that frequent. Like women, there are a group of women that all they need to do is once in 3 years. There are some places whereby it is even once in 5 years, depending on the findings, depending on the available measures that you have in that environment. Now, when you do a test once in 3 years, that can tell you if one can develop a cancer in the next maybe 15, 10, 20 years to this time. Isn't that test worth doing? So I want to encourage us now to go to a nearby center to do your Papa-Nicolau smear, and also encourage you also to ensure that you do your self-breast examination every month. And sometimes for this self-breast examination, like once in a year, you should also present yourself to a physician that will help in examination of the breast, sometimes like once in a year. And of course, for women that are older than like 40 years and above, you should, if there's means, I think it is very advisable for you to go for mammography. This is also a measure a measure that is known to identify the onset of breast cancer on time. So by this, I want to encourage us to take up our Papa-Nicolau smear. A nearby facility will do Papa-Nicolau smear for you, whereby this is just a simple examination. We want to expose the cervix through the vagina with the use of speculum. Just minimal discomfort, and scraping of the cervix will be taken for cytology, and the result will come out after some days or even few weeks to tell if there could be occurrence of any untoward findings that may help in identification or in prevention of cervical cancer subsequently. So now, please kindly read more on Papa-Nicolau smear, then self-breast examination, with the aim of implementing it in order to benefit every one of us. So let us enjoy the World Women's Day by reading more about self-breast examination implementing self-breast examination henceforth, and also ensuring you go for that Papa Nicholas meal. I'm Dr. Adeniran, a consultant obstetrician and gynecologist. Thank you for joining me.